Hi everybody, welcome to my Holistic Fitness Masterclass. We're going to get into how to reduce aches and pains, boost your energy and mood, and how to reduce random symptoms on your health and fitness journey. Thank you for joining me because I know there are so many places that you could be right now and you are here learning about your body. My name is Dr. Aissa McGuirl. I'm a holistic physical therapist, fitness coach, speaker, and author of the book, Connect the Body Dots. And I just want you to feel good in your body. But the thing is, so many of us don't even know what good actually feels like. And when I say good in your body, I like to describe it as feeling free in your body. When your body doesn't actually hold you back from doing whatever it is that you are trying to do in life. So, how do you feel? How do you really feel? This is one of the questions that I ask all my patients, all my clients, or people in general. How do you really feel? So we're going to go through this list. And you might be thinking at this exact moment, like, how am I feeling at this exact moment? So think about it that way, but also think of maybe how you felt this morning or last night or when you were sleeping or throughout the day, because you're going to feel a little bit different at different points in the day. But I want to bring awareness to how we're feeling. So at the end, we can get into how actually you fix it. So, do you feel tight? This is one of the biggest complaints that I see is you feel tight all the time in your neck, like your shoulders are always at your ear. You're like doing these things all day just to feel like you're loosened up. Your back is constantly tight, maybe your hips, just random, just tightness. Like you feel restricted in your body. Maybe it's making you feel a little bit claustrophobic in your body or even claustrophobic in your head just because you feel so restricted. Now, some people will describe it as tight, but some people actually feel pain. Like this pain actually limits you from doing certain things in your everyday life. Do you feel pain in your knees when you're going down the stairs, when you're squatting to pick something up off of the ground? Or because you're a little bit more active, you feel this pain in your knees whenever you're doing anything at the gym, such as a squat, a lunge, running, jumping, or because it hurts so bad you're not actually doing it anymore? Do you have pain in your back or pain going down your leg? Maybe you've been diagnosed with something called sciatica and you feel like this is something that you're just going to have to deal with. Maybe they did the x-ray or they did the MRI and it's showing some disc herniations. And you feel like just because this is what they said, you feel like you're stuck with this because you don't want to go through surgery. This is something that you're just going to have to deal with. And now this pain is limiting you from things that you actually want to do in life and in the gym. Do you feel bloated all the time? Like your belly is like pooching forward all the time. And you didn't really eat all that much. Your belly is just sticking out all the time. And it wasn't always this way. Or your ribs are flaring forward, like your ribs kind of like poke out in the front. Your head's coming forward, your shoulders are coming forward. Maybe you're actually noticing a little bit of a rib hump in the back. And maybe you used to have a nice juicy booty. Maybe you never had a booty. And your butt's kind of like tucking under. So you notice your posture's off. Over the years, your posture continues to become more and more off. And now, when you put on clothes, you don't feel as confident in your clothes. And when you walk into the room, you don't feel as confident because your shape, it's actually changing over the course of the years. And maybe this shape is actually contributing to that tightness or that pain that you're feeling. Do you have reoccurring headaches? And having a headache is one of the most difficult things to make it through with your day. Like, how do you go throughout your day when your head is actually hurt? Like you're trying to think of all these different things that you got to do, but your head feels so cloudy, so foggy because it actually hurts. And you've been taking medication just to manage it. And you feel like this is something that you're just going to have to deal with. Or I want to point this out. Sometimes people notice that these headaches come on more so after the gym, after a heavy lift day, after a heavy leg day, after you did very intense workout. Do you notice is that when your headache starts to come on? Do you have to go to the bathroom all the time? like every hour in the day or multiple times at night. Or when you put the key in the door or you turn on the faucet, you immediately have to go. Sometimes you make it, sometimes you don't. Sometimes a few drops slip out, sometimes it might be a full stream. And you actually feel a little bit embarrassed because you just peed your pants a little bit. No shame. We're going to get into how you can actually fix this. No shame. I'm just putting it out there. These are things that people experience. But again, I want to point out, this is not something that we have to continue to deal with. Do you have heaviness in your pelvic region? Like you're feeling this dragging sensation. And because you're feeling this dragging sensation, it's actually limiting you from the things that you want to do in the gym. You're afraid of running. You're afraid of jumping. You're afraid of lifting heavy. And it makes you feel kind of sad because you used to be so active. You used to be able to do all these different things. And now you're scared because every single time you go to do something that is going to be contributing to bettering your health, making you happy, you feel this heaviness, this dragging, like this something is falling out of there. And this more so happens after kids. Let's talk about the bedroom. Don't enjoy it? Does it hurt? And for the guys, can't get it up, can't keep it up? Or you just don't want to do it. Like, why would I want to do that? Can't poop. You can't poop. You've been backed up for a few days and you feel like you're weighed down because you're full of poop. And maybe because you're full of poop and you feel like you're so weighed down, you're a little bit anxious, maybe a little bit angry because you haven't pooped. Do you have horrible periods or PMS symptoms? If you have to take a whole week off from the gym, you're making all this progress throughout the month, you're extremely motivated, and as soon as your period hits, maybe a little bit before that, your energy tanks. You're a little bit achy, have a headache, and you just don't want to do anything. And because you don't want to do anything, you're not as active. You might be eating a little bit more. So it feels like you could never make any progress because these PMS symptoms take you out. Or you just don't feel your best. Not this one blatant thing that's wrong, but you have all these little fires going on in your body. None of them are particularly that bad, but you just don't feel your best. You have these random aches and pains. Maybe you feel a little bit tight. Maybe you're noticing random rashes. Maybe you're noticing your energy is dipping despite your cups of coffee, despite your sleeping. You just don't feel your best in your body. And maybe because of this, you're always at the doctor's office wondering what's wrong, but they really don't have an answer for you. And their solution is, hey, maybe you could try this medication, but maybe you don't want this medication. Maybe you want to actually fix why these things are going on in the first place, but you really don't know why or how to start. We're going to discuss all this so that you could live your life with confidence in your body. Why? Because you deserve to live your life with confidence in your body so that you could be the best version of you with your body helping you rather than holding you back. I am here to teach you how much control you have over your beautiful body. These symptoms, this list that I just went over, is your body just saying, hey, something's off. And it is our job to listen, our job to connect to what our body is saying, understand what it's saying, and do something about it because you are in control of your beautiful body. All of the symptoms that I just mentioned, I've treated and worked with each of these over the course of my career. I've also experienced almost all of them, but differently at different points of my life. I've learned through extensive research, through working with hundreds, maybe thousands of patients over the course of my career, and my own frustrations with my body. I know exactly what it feels like to be stuck and frustrated with your body. Stuck and frustrated when doctors tell you that there's nothing that they can do, or that that's normal, or try to throw some medication at you. All I've wanted to do was feel good in my body and help other people feel good. But my sensitive body has always held me back. But I'm happy I went through it. Yes, it was scary, very frustrating, but it made me ask more questions. Guys, ask more questions. We need to understand this one body that we have, this one body that's supposed to last us our entire life. But so many of us don't understand it. So I asked more questions. It made me challenge everything that I knew as a former athlete, a fitness professional, a medical professional. It made me dig deeper beyond these surface level answers. And it helped me understand my body, the human body, and all of our individual differences. And it brought me to where I'm here today, to help you learn from my mistakes, the mistakes of all the people that I've worked with, the mistakes that are being perpetuated by social media and this extremely false standard, and give you control of your body. You are in control of your body. Here is what we're going to go over today. Why what you're doing isn't working all too well. Maybe it's working a little bit, but maybe you're still noticing you still don't feel your best. We're going to discuss how all of these symptoms connect. There's a missing link, and I'm going to point that out to you guys. And then at the end, number 3, we're going to address how to fix it. You're going to want to stay to the end to get to the how-to. I'm not withholding any information from you, but the information that you get leading up to the how-to is vital in fully understanding how to best help yourself. So many times we're looking for the quick how-to, and then we do the how-to, but not fully understanding the whys behind it. And within the whys, this is what allows us to make better decisions in our everyday so that we could feel better in our skin. To be transparent, yes, I will offer you at the end my 30 Day to Forever Holistic Fitness Coaching Challenge, which is $297. But I say that now just to get that pressure out of the way so that you can fully absorb everything that I'm trying to teach you about your body. You are about to get so many aha moments, get the answers to so many questions that you've always wondered. And if you don't feel like you need my help at the end, that is completely fine. But you are here to learn about your body. And if you would like my help, I would be more than happy to help you. All right, so whether you plan on getting the challenge, whether you are here to learn, sit back, get a pen and paper, reflect. I want you to ask more questions. Even pause this video as you're watching it. Sometimes just pausing, sitting there, thinking, reflecting, writing down some thoughts that come into your head. And just learn why what you're doing doesn't work. So I think it's becoming pretty common knowledge that if we exercise and eat better, we feel better. Maybe we lose some weight. Maybe our aches and pains start to dissipate. But so many of us get to a point where we're exercising, we're eating well, whatever that means. We'll get into all this stuff in the end. But we still don't feel well. So when we go to the gym, a lot of us are taught cardio. So we do our cardio. So we stay on our cardio machine. Maybe we're running on the road. Maybe we're doing our group exercise classes. And then there's some of us that might do a little bit more strength training. So we're in the gym doing our strength training. Maybe we're lifting some weights, maybe some light weights that we've never actually increased the weight for years. You've been doing this bicep curl with 5 pounds for years and you've never actually increased it. Maybe, is that you? Yes, no? Or maybe you're doing a whole bunch of heavy strength training. You know that you need to build more muscle mass, so you are doing your strength training. Or maybe your strength training is in these group exercise classes. You're in and out of different classes. You pick random weights at each time. You pick, there's really no schedule in the strength training that you're doing. And maybe you're doing some yoga, maybe you're doing some Pilates, but there's no actual structure in anything that you're doing. You're doing random things at random points, at random times, and you're not necessarily seeing the results that you'd like. And you're not seeing the results that you'd like, but at the same time, you're struggling with these aches and pains, not feeling well, these random symptoms. And so you try to fix it, right? We don't want things to just stay there. We want to do something about it. So maybe you start to get a massage, and you get the massage, and you get off the table, and you feel like you have a new body. But then 2 to 3 days later, you're feeling about the same. A week later, you're feeling about the same. So you're wondering, did that do anything? That felt really good, but I'm still back at the same spot that I was at before. And some of us might actually do some mobility work. So you notice you're not feeling the greatest. So you start doing some stretches. Maybe you start doing some yoga. And maybe it feels well, but it doesn't get rid of the pain. It doesn't get rid of the symptoms like you wanted it to. You still just don't feel your best. And people are starting to do more core work. Some of us want to get that slimmer midsection, or we know that strengthening our core might be able to take care of our back pain, our pelvic floor issues, or just help our posture overall. Some of us have that train of thought. But when we go to do our crunches, our ab machine, our flutter kicks, you're finding it's not really doing anything for your midsection. You're doing these exercises, but you feel it all on your neck, all on your back. It's not really helping all too much. And you still feel stuck. And all over social media, you're going to see all of these different supplements. So you try this supplement and you think this is going to be finally the thing that saves me and helps me feel good. So you try it for a week and maybe you feel a little bit better, but it still doesn't resolve the symptoms that you're experiencing. You still feel achy. You still feel off. Your energy's still low and you just feel stuck. You're doing everything right, but you still feel stuck. Back when I was a new grad, I graduated PT school in 2017 and I jumped right into seeing patients for neck pain, back pain, shoulder pain, foot pain, hip pain, pain everywhere in the body. And I was treating patients, and when we treat patients, we treat with soft tissue work, so kind of like massage. We don't call it that. So soft tissue work, joint mobilizations, as well as core exercises, mobility exercises, and strengthening exercises. So I'm treating all these patients and they're getting better. So good. I went to school for 7 years and I'm treating the patients with all the things that I learned and they're getting better. Cool, right? But at the same time, I'm struggling with the same issues. My neck was constantly tight. My back was constantly tight. I had knee pain. I had foot pain. And at the same time, I know how to eat well. I know how to strength train. I know how to do core mobility exercises. I was doing my soft tissue work. I was doing everything right. But all the things that I treated patients for was happening to me. I felt like the biggest fraud. Granted, my patients were getting better, but why is it that I felt this way? So what I did was I switched things up a little bit. So I switched things up into focusing on a little bit more core and mobility work. So some of the things that you might be doing right now. So still did my strength training, still did my cardio, I still did everything, but I switched up my focus a little bit and my symptoms, they started to improve. But any time in life where things got a little bit stressful, when I started working more hours, when I got a new position at my job, when I became pregnant, when I was a new mom managing a newborn at home while working, when I moved away from my friends and family, when I started a business, when I went through a breakup, when I went through financial difficulties, anytime I experienced a significant stressor in my life, my body would say, hey, something's off. And even though I was doing everything right, my body didn't like it. Now, why was this happening? Why was I experiencing all of the symptoms or most of the symptoms that I just mentioned before? It was because I never addressed the foundation. So many of us jump into an exercise program, jump into doing whatever, but we neglect the foundation first. So probably you don't know anything about building a house, right? But I'd imagine, which house of these would you want to live in? I'd imagine you'd want your house pretty straight, right? When they go to build a house, you'd probably want to make sure that the ground is level, right? You want to make sure that the cement is nice and smooth. You want to make sure that the beams are up straight so that when they go to build the house, it's up straight. You probably wouldn't want to build it straight on a hill where they never leveled it. The cement's all lumpy and bumpy. The beams are crooked. Because when a storm hits or when stress hits, what's going to happen to that house? In 10 to 20 years, which house do you think is going to have the cracks in the wall? The electric's going to be off. The plumbing's going to be off. The tiles of the roof are falling off. all because of the foundation. We need to address the foundation first. The foundation of how we move as humans is our breath. Breathing is not just about getting air in and out. The way you breathe creates the foundation for how our body stabilizes, how our body moves, and how our body functions. So your breath is what creates the foundation for our movement. And this foundation is what is called your deep core. You might have heard of this, core training, but we're going to talk about deep core training. So what is deep core? What is not deep core? So let's talk about what is not deep core first. So when you see people in the gym doing their crunches, doing their sit-ups, a lot of the times what we end up doing is training our outer ab muscles. So we're training our outer ab muscles and maybe some other muscles in it that we're not intending to train, that neck, that back. And oftentimes what we end up neglecting is these deeper structures, our deep core. So our deep core is this innermost layer. It's our foundation. It's this innermost layer, not these big muscles on top. It's this innermost layer. In the front, you have your transverse abs. These muscles act like a corset that kind of pull everything in and stabilize us. At the top of our deep core, it's not just our deep abs, it's our diaphragm. Our diaphragm is our primary breathing muscle, and this sits on top. We have these deep muscles within our back, and on the bottom, we have our pelvic floor muscles. So all of these muscles work together as our deep core. So I said breath, right? And so many of us will hear the term belly breathing. So like we breathe, diaphragmatic breathe into our belly. But when we breathe, we're trying to get air into our lungs, right? Right? I think that's pretty common. So we're trying to get air into our lungs. So why when we're breathing, we're trying to breathe into our belly? When we're breathing, we're trying to get air into our lungs, into our rib cage. So when we talk about the deep core, we talk about our breath, it is these deep core muscles on the bottom and our lungs or rib cage on top. I like to think of it as two balloons. So we have an air balloon on top that represents our lungs and rib cage, and a water balloon on the bottom that represents our deep core and pelvis. And how these balloons sit on top of each other, this is our posture. Now these balloons and how they sit on top of each other, this is what's responsible for stabilizing us. This is what's responsible for allowing us to move in all different directions. All of this is responsible for the functionality of our entire system because we are creatures of movement, and this breath is important for everything that's going on inside of us. Not just getting that air in and out, but the function of everything that's going on inside of us. So, to tie it all together, our breath is our foundation. Our breath is tied in with our deep core. And this breath and deep core are integrated in everything that we're doing in the gym, but also in life as well. Our breath is the foundation of how we move as humans. When we breathe in, our air balloon is going to get bigger. When we breathe in, we're going to breathe in through our nose, and our air balloon is going to get bigger. As our air balloon gets bigger, our diaphragm is going to contract downward as it pulls air in. As this happens, as we're pulling this air in, our abdominal contents are going to move downward. We're going to get lengthening through our belly, lengthening through our back, lengthening through our pelvic floor. So as we breathe in, everything is lengthening and expanding. So when we breathe in, I like to think of breathing in as mobility. And when we're breathing in, we're using our diaphragm to get this air in everywhere. Some of you may have heard this term called 360 expansion. When we breathe in, we're getting this 360 expansion everywhere. This is what's literally stretching us from the inside out. Now, when we exhale, so many of us don't understand the importance of this exhale. This exhale is this deep core contraction. This exhale is that stability. When we exhale, we're going to get a slow exhale, and we're going to feel compression of our core muscles. We're going to feel a lift of our pelvic floor muscles as our pelvic floor muscles take our abdominal contents and shift them up. We're going to get compression of our deep ab muscles that compress everything inwards as our lungs and rib cage get smaller as air is being expelled. This is what's providing your body with stability. So when we're breathing more effectively, more efficiently, we're providing our body with stability. We're providing our body with mobility, which is important for the function of everything inside of our body. And when we don't breathe efficiently, our body's going to compensate. Our body's going to try to help us breathe. And when our body compensates, especially when we're doing this for years at a time, our body doesn't work as effectively. This is those aches and pains. This is your lack of energy. This is your mood. This is those random symptoms, all because we don't have this foundation down first. So let's give it a try. Our core and our breath are more effective when they sit on top of each other. This is having a better alignment or a better posture. I want you to sit up. Maybe you're sitting, maybe you're standing. You're probably sitting. So I want you to sit up nice and tall. Get some length in your spine. Now, if you're sitting, I want you to feel these two bones that you have underneath you in your butt. So those are your sit bones. So I want you to feel them right underneath you. So you're sitting up nice and tall. Now, when you breathe in, we're going to feel this 360 expansion. Air is going to move into our chest, sides of our rib cage, belly, back, and pelvic floor. This is that 360 expansion. When you breathe in, don't breathe in with your shoulders creeping up towards your ears. Keep those shoulder blades nice and relaxed. That's that breath in. And we always breathe in through our nose. If you are breathing with your mouth open all day, that is contributing to so many issues. So we're going to focus on breathing in through our nose. So when we get that breath in through our nose, we're going to feel this 360 expansion. Chest, sides of our rib cage, pelvic floor, back, belly. Then when we exhale, we're going to get a slow, long exhale. Emphasis on this slow, long exhale. The biggest thing that I see is people are breathing out way too fast. We want to start to slow down that exhalation. This is going to get us to get that deeper engagement of those core muscles. When we get this exhale, what you should feel is a lift of your pelvic floor. Ever heard of a Kegel? Have you tried Kegels and they didn't work? Because you're not using your pelvic floor muscles with the rest of your body. This is a more functional Kegel. I don't really teach Kegels, but when you get this exhale, you're going to get a lift of your pelvic floor, compression of your lower belly, middle belly, rib cage, as you slowly, fully exhale. As we're trying this right now, you could breathe out through your mouth, kind of like you're either bogging the windshield or like you're blowing out birthday candles. I usually find birthday candles is a little bit easier to feel these core muscles, but for the sake of trying to connect with our breath, either birthday candles or bog up the windshield. Breathe in through your nose. You're going to get this 360 expansion. We're not doing it yet. I'm just walking you through how to do it. So when we get this breath in, we're going to get this full breath in through our nose. Everything expands, it gets bigger. Slow, long breath out. You'll feel that lift of your pelvic floor, compression of your lower belly, middle belly, rib cage, as you slowly, fully exhale. Okay? Sitting up nice and tall. I'm standing. Going to get this slow breath in through your nose. Everything is going to expand and get bigger. Now, as you breathe out, you're going to get a slow, long exhale. Lift, zip. Full breath in through your nose. Exhale. Full breath in through your nose. Make sure your shoulders are relaxed. Exhale. So key things to remember. Sit up nice and tall. Always breathe in through your nose. Relax those shoulders and slowly breathe. Though this breathing strategy will differ depending on the activity that we're doing and our particular goals, slightly depending on goals and activity, this breathing strategy is the foundation of how we move as humans. And as humans, we're creatures of movement. We are creatures of movement, but we need to start to move better. And this breathing strategy is the foundation of how we start to move better. So was that hard? Did you feel like you couldn't get it right? Are you feeling like, I never thought I would have to learn how to breathe? I've been breathing my entire life. Why do I have to learn how to breathe now? So our breathing pattern can get thrown off for various different reasons. So 1, diet. I'm not going to get into this, but so many of us living on processed food, overeating, undereating, can throw off everything going on inside of us and our breathing pattern. Sitting too much from work or school, or maybe you just don't want to move all too much. It makes us more tight, causes us to hold more tightness and tension in our body. Stress. Woo! So many of us are stressed out. We got 10,000 things to do. And when we have this 10,000 things to do, we got to wake up, go from point A to point B, take care of the kids, go to work, run a business, do all these different things. Our body holds this constant level of tension. And when we hold this constant level of tension, we're not breathing all too well. So many of us are exercising with not the greatest form, causing us to overuse some muscles in our body that are particularly a little bit stronger and neglecting these deeper muscles. Some of us are over exercising. And again, these big muscles start to kick in and we neglect these deeper muscles. And all of these things together develop into more tension in our neck, our back, our hips. When we're pregnant, our abdominal muscles are going to lengthen and expand to accommodate our growing baby. So our core muscles are going to lengthen and expand to accommodate our growing baby. The pelvic floor muscles on the bottom now have all this weight on it, so they're expanding as well. So when these muscles are expanding, they don't work as effectively like they're supposed to, but this is naturally supposed to happen. But if we're going into pregnancy, after we've had these patterns for a period of time, these muscles aren't going to be as effective when we're pregnant. And then after pregnancy, especially if we don't rehab properly, these muscles don't always just return back to how they were previously. So they stay lengthened. These deep core muscles stay a little bit lengthened. Maybe you have a DRA. These pelvic floor muscles stay a little bit lengthened. And because these muscles stay lengthened and we've never learned how to reconnect with these muscles don't work as effectively. And when these muscles don't work as effectively, our body's going to try to find ways to help us get through life. We need these muscles to stabilize us and help us move. But because we've never reconnected with these muscles, our foundation is off and our body compensates even further. This is that tightness and tension in our neck, our back, because these muscles are helping us move more, but not as effectively. And if we never address the root of the issue, why we're getting this constant tension at all times, our body continues to compensate further and further and further. So these things get worse and worse over the course of our life because we never addressed the root of the issue. Muscles in our neck, our back, even those outer ab muscles in our hips. What this does is it squeezes our balloons. And our body remembers that our balloons are squeezed all day long. And what this is doing is it's disrupting our alignment. It's disrupting our posture. It's disrupting how everything moves and functions within us. So when we have these squish balloons for years, we're going to take these short, shallow breaths. And when we take these short, shallow breaths, we're not getting enough air into our lungs. And when we're not getting this air into our lungs, in combination with these short, shallow breaths, we're getting in this oxygen, but our body is not going to be able to use it as effectively. We're breathing, but we're not supplying oxygen for everything in our body, our brain. This could be why you're anxious, This could be why you're exhausted, because we're not breathing properly. Now at the belly region, I know we're talking about our lungs and rib cage, but what about the belly? So when we're trying to breathe, we're trying to get this air into our lungs using our diaphragm. Our diaphragm is our primary breathing muscle. That's what we're supposed to breathe with. But when we're tight and restricted, we can't breathe as effectively, but we got to get this air in somehow. So we use these big tight muscles, our neck, our back, to help us get this air in. But we're not doing it effectively. So every time we go to get this breath in and we're using these muscles in our neck and back, but we're not actually expanding our rib cage, what we're doing every time we take that breath in, we're using these muscles, and what it does is it just puts more pressure downward onto our belly region. This could be why you have this rib flare. This could be why your belly is pooching forward. This could be why your posture is sinking forward, your head is coming forward, because every time we take a breath in, we're not expanding our rib cage, we're just pushing everything downward. So when we breathe in, we're tightening up our neck, we're tightening up our back, we're tightening up our hips. So it locks our body up. So it's locking our body up so we can't rotate, okay? So you ever seen somebody in the gym and they just walk like a refrigerator? It's because their body is so locked up. Our bodies are supposed to rotate when we walk, when we move. We're creatures of movement and we move by rotation. But because so many of us don't move well, we're not actually rotating. And when we're rotating, this is affecting everything going on inside of us. Our reproductive organs, our gut, all these things that are going on inside of us. So if we're not walking with this rotation, we're walking kind of like a refrigerator. We're getting this constant pressure in those organs. We're not getting this pumping motion through our digestive tract. This could be hormonal issues. This could be gut issues. This could be things going wrong in this area because we have not addressed our movement. This tightness, this restriction in our body is not allowing our organs to function like they're supposed to. We've talked about our rib cage. We've talked about our core and our pelvic region. What about our spine? When our balloons are squished, when everything is so restricted, it's going to restrict our spine as well. And within our spine, we have all these nerves that come out. Within our neck, you have nerves that come out that supply everything down your arms and into your hands. From our back, we have nerves that come out our back that innervate things in our belly region, our pelvic region, our legs, our feet. And when everything is so squished, these nerves get squished as well. Nerves that don't have room to move don't work well, or they hurt. This could be numbness, tingling. This could be pain. This could be weakness because our balloons are so squished. And like I said, this is the foundation of everything. So our rib cage, our pelvis. And when this is off, it throws off everything else as well. It's going to throw off the position of our shoulders, our elbows, the position of our hips, our knees, our feet. This is a connection of all of these things that are going on inside of us because we don't address this foundation first. This could be that pinching in your shoulder every time you reach your arm over your head to do a shoulder press. This could be that pinching in your hips. This could be that knee pain, that tendonitis in your knee, that Achilles tendonitis, that plantar fasciitis, any of those aches and pains that you're experiencing in your body, all because our foundation is off. And this is not to diagnose you. I don't even like diagnoses, but these are some terms that you might have heard before, but the terms that you've used before might just put a label on the symptoms that you're experiencing, but not address why these things are happening. We got to address the foundation of how we move. All right, so we just talked about this. I'm not saying you're doomed or anything. We're going to talk about how to fix it. So how to fix it. First off, if you've been struggling like this for years, you've had tightness in your body, things have gotten progressively worse over the course of years, you're a bit stressed, maybe you've had kids, we want to start to address our squished balloons. We want to start to unsquish our balloons first. We want to start to do some soft tissue work. So in the beginning, I said Massages, like you feel good afterwards, but it eventually comes back. So the massages aren't bad. The massages are great, actually. I love a good massage, but it's really important what you do afterwards. So if you've been struggling for years, soft tissue work can be extremely helpful, particularly in our neck, our back, our hips. If you don't have access or the funds for a massage therapist on a consistent basis, things like foam rolling, massage balls can be particularly helpful. If you do have access to a massage therapist, great. If you do have access to a physical therapist where they're able to do dry needling, this is one of my favorite techniques to perform on my patients. This, I like to think of it as like a quick boost. Dry needling to our traps, our back, our hips are quick ways to improve our mobility so that when we start to connect to our breath, we're able to connect to our breath better. That brings me to number 2, connect to our breath. So one of the reasons why so many of us had a hard time doing it is because our balloons are squished. So sometimes unsquishing our balloons first, soft tissue work, dry needling first, can help you connect with your breath better because it puts us in a better alignment. So these muscles are able to work more effectively. So that was probably your first time trying to breathe a little bit more effectively. It takes time. So if you did that 1, maybe 3 times, you probably didn't get it. It takes repetition. Think of the first time you maybe played a sport, rode a bike, went to the gym. You didn't get things on the first time. It takes repetition. So learning to connect with your breath, it takes time and consistency. So try this on a consistent basis. So you tried it sitting here right now, but maybe you could try it when you're standing up throughout the day, waiting in line, sitting at your computer desk, doing your work, taking a breath, laying down at night. Try to start to connect with your breath better at different points in the day. Yes, you could do it through strategic exercises and whatnot, which we're going to talk about in a second, but you can connect with your breath at any points in the day, and people don't even have to know that you're doing it because they shouldn't have to know that we're doing it when we're doing it correctly. All right, number 3. So like I said, this breath is the foundation of everything. And if you remember back to my story, I said I focused on more core and mobility work. So this core mobility work, it is amazing. So yoga, love it. Pilates, love it. Strengthening your core, love it. But it's how you do it. So first off, if you're doing like your core exercises, you're doing all your crunches, you're doing your planks and stuff, you want to start to connect with this deep core first. And this deep core or this breath should be applied to all of the core work that you're doing. You want to apply this breath to your mobility exercises as well. Because what I find is so many people are tight and they're doing these stretches over and over again. But oftentimes, so many of us are tight at our foundation. So many of us are tight at our balloons. And so many of these stretches don't necessarily address the tightness at our balloons. And how we address that tightness with our balloons is you need to add this breathing component on top of this. So this stretches us from the inside out. This stretches us at our balloons. We're stretching ourselves or improving our mobility at the root of the issue. So this breath can be applied to core work and mobility work. All right, so we got unsquishing our balloons. We got connecting with our breath. We got tying this breath into core mobility work. And then lastly, this core, it's not just our balloons. This deep core, it's not just these deep ab muscles in our rib cage. These deep core muscles are tied in with everything in our body, from our foot all the way up to our head. So these deep core muscles need to be working with every single movement that we're doing. This deep core work can be applied to all of these strength training workouts that you do at the gym. So we want to start to apply this breath, this core work into all of the movements that we're doing at the gym. We want to start to do these movements at the gym more effectively. This is going to give you so much more out of these movements. And we want structured training. So we want to move better during our workouts. And we need some level of structure in our workouts because if we're doing random things at random times, we're not able to build on anything. And when we're not able to build on anything, this is lack of results. And this is why you might not feel the best, because we're doing random things at random times and our body never gets a chance to adjust and get stronger and adapt. So we need to apply this breath and moving better in our program, and we need some actual structure. The main thing is we need to move better when we're working out, and we need some level of structure when we're working out. Better quality movement and some level of structure. This is what most people are missing. This is why so many people don't feel well despite doing everything right. So I want you to think for a second. What would you do if your body didn't hold you back and you truly loved everything that your body could do? If your back didn't bother you after a workout, you didn't have to take a few days off from the gym just because you did a workout. If you weren't exhausted just because you're actively trying to take care of yourself. What if you didn't have to take a week off from the gym from your monthly cycle and you're actually able to make progress week after week? What if you weren't scared on a consistent basis that you're just doing this one thing that's going to hurt you and it's going to set you back weeks or months? What if you got back to doing the things that you used to love and loving how you used to feel? I want you to see the future. Maybe a week, maybe a month, maybe a year, maybe 10 to 20 years. Your future is based off of the choices that you make today and the series of choices that you make after today. It is all a choice. So if you have the understanding, you have the knowledge, it's now a matter of a choice. I'm teaching you this so that you could feel your best. Less aches and pains. Your energy's better. Your mood's better. You have less random symptoms. You look your best. You have a better posture. You're increasing your muscle mass. You have a healthy amount of body fat. So you feel confident in your skin. And you function at your best. You're able to do everything that you need to do, everything that you want to do, and you're able to show up at your best as the best version of you so that whatever it is that you are trying to do in life, you got it. I want you to love your body. I want you to make it through your day without simple things hurting. I want you to be active in the gym so that you are building resilience in your body. I want you to be able to play with your kids and enjoy seeing your kids grow up. Not feel like it's a chore or it's actually going to hurt you. I want you to save time and money from visiting the doctor's office, taking time off from work, spending all this money on these copays, looking for all these different doctors that never give you a solution when the solution is right within you. I want you to be able to be more active and love to play again, love to move, find joy in the simple things in life. So we're not looking for artificial joy from our phone, from the TV, from people that don't actually fill our cup. I want you to feel actual joy just from being you, just from feeling good in your body. I want you to age with ease and grace. So many of us see our parents and grandparents struggle with various health conditions. And I want you to know that does not have to be you. It's all a matter of a choice. But I don't have the time. You don't have the time, or you don't make the time. We have all of these different things going on in life. And what I want you to take away, it's a matter of your priorities. So we have all of these things that we have to do. But I want you to reflect. Do we have to do all of these things right now? And what are you doing with your free time? Within your free time, and when I say free time, I'm talking about the hour before you go to bed, your lunch break that you have, the 5 to 10 minutes that you have an actual break. What are you doing with that time? All of those instances are periods of time that you could do something to allow your body to start to feel better. But I'm already exercising. I'm already doing core work. I'm already doing mobility work. I'm already doing strength training and cardio. I'm doing all of these things. It's not just doing it. It's a matter of how you're doing it and the structure and consistency of what you're doing. This is where so many people go wrong. It seems so simple. It seems like that is way too easy. Why is that the answer? Because it's the foundation. And so many of us are neglecting the foundation and jumping into all of these different things. And it's really the simple stuff that allows us to feel better in so many different ways. I want you to know you are in control of your body. It's all a matter of a choice, understanding, and showing up consistently and doing your best on a consistent basis. I've been given a whole bunch of diagnoses: ADHD, dyslexia, fibromyalgia, chronic pain syndrome, PCOS. I'm not even going to talk about kind of like the aches and pains that I've been experiencing. I don't like diagnoses. I've been given these diagnoses, but I could run, I could jump, I could play. I could run a 5K in under 30 minutes. I could play a game of basketball at 34 years old. I'm faster than most men. I could jump. I could play with my daughter. I can go to the trampoline park. I can do all of these different things because it is a choice. And it's not just me that I'm talking about. I've had people go from being in a wheelchair to now walking, from peeing their pants from simple daily tasks to now working out, from not being able to have their period to get their period and now be pregnant, from not being able to walk well, go down the stairs because their knees hurt so bad, to being able to run. People have gotten back their life. I enjoy my life. I love my body. And me and the people that I've helped are no different from you. It is all a matter of a choice. Like I said, I was going to offer you guys my challenge at the end. So we're talking about my 30-day to forever holistic fitness challenge. I want you guys to be able to understand how to connect with this core, how to do these mobility exercises, how to do these core exercises, and how to have some level of structure, and all the little things in between that I didn't get to talk about today because I'm trying to stay on task. So this is my 30-day to forever holistic fitness challenge. This helps you learn how to understand your body, how to move, how to build these habits for 30 days. And the cool thing is you build these habits for 30 days and you just continue with these habits for the rest of your life. It's really simple. Build these habits for 30 days and you continue with these habits for the rest of your life, and you just make progressions. This is how anybody reaches their goals. It's understanding the process and doing these things over and over and over again. So you're going to receive self-massage techniques. So I talked about unsquishing the balloons, calming down those tight muscles. We can do self-massage techniques to allow these muscles to start to relax. Don't have to go to a massage therapist. You can use massage balls to do these self-massage techniques to help your body calm down. This is something that I do at least a couple times a week, and it helps me feel like I got a new body. And I get to do it at home, and I don't have to go out and pay for a massage. You're going to receive mobility routines that help you move better. So I talked about it. This breath could be tied into mobility work to help us move better at our foundation. But how do you do that? That's what you're going to get in this program. You're going to receive core exercises, not just the typical traditional exercises that everybody's doing and it's becoming ineffective. I'm going to show you how to tie this breath in with actual core workouts so that you're able to see actual results. And these exercises get progressed. You learn one skill, you get stronger, we make the exercise harder, and this is how you see results. You're going to get workouts, upper body, total body, lower body, and then there's slight differentiations between men and women. So you're going to get all of these different workouts that's tying this core into every single thing that you do and giving you some structure. And like I said, over time, we need these things to progress because this is how we get stronger. I'm going to teach you how to progress, when to progress, and show you different ways that you're able to do these exercises if problems arise, because everybody is so different. You're going to see cardio routines fit for your particular levels. Some of us hate running. Some of us hate these machines. And I'm going to show you a couple different ways that you're able to get your cardio in so that you can help with maybe if you're trying to lose a little bit of fat, maybe you're trying to recomp your body. I'm going to show you how to do cardio in a more effective way. Recovery routines. So a lot of times people think of recovery as like sauna, ice bath, massage. Cool, great for certain people. But you know you could use movement to allow your body to recover better? The times where I've made the most progress in my fitness goals is when I'm very good at my active recovery routines. So when I say active recovery routines, I'm talking about being very intentional with how we're moving outside of our workout to allow our body to recover better so that we get better results. This helps us with our energy. This helps us with our mood. It helps us with a better posture. It helps us use our muscles more effectively when we're in the gym. So our recovery routines. You're going to receive nutrition habits and meal ideas. I didn't get to talk about this because I was trying to do a good job of staying on task, but nutrition is 100%, 1000% essential in all of this. You're going to see meal ideas and nutrition habits to help you with your goals. And you're going to receive support. We need some support, right? So you're going to have questions. I want you guys to have questions. If you don't have questions, I want you to come up with them or be around people who are going to ask questions as well. You're going to receive my connected community. So within this community, you're going to be able to support each other. You're going to have my support where we do weekly calls that I'm able to answer all of your questions. Because this is a journey. You can't just get one thing and then just do it. Might work for a time period, but so many times people have this one blaring question, and this one blaring question is holding them back. We need to be able to ask the question to get the answer, to find the solution, to help us get over these bumps. And that's what we're going to do in this community. All of this is so that you can maximize your results. Feel your best in your body. Look your best so that whatever it is that you're trying to do, you got it, and your body is not holding you back. For something that is a little bit more individualized. You want quicker results, you need a little bit more help. I do take a select few clients in my one-on-one programs, and this could be performed in person, in-app, virtually, or the retreat style. Or if you have a group of people struggling with some of these issues, the aches and pains, their energy's off, their mood's off, they just don't feel their best, and it's showing up in the work that they do. I love to go into corporations and events and teach people how they are able to take control of their body. So I'm going to drop the link wherever you are viewing this video. And again, I want to thank you for joining me. Thank you for taking the time to understand your body and listen to what I have to say. And I hope from this video, this talk, you have some more questions answered. And I want you to know you are in control of your beautiful body. Bye, guys.